afternoon from the Combined about a really kind of like not that further still. Can you walk us through that?
Yeah, possibly 4, 6, maybe even 8 weeks started where we heard people of injecting medicines into the vitreous in some aspects and so now we have, I think, we have a problem with people being able to afford them anymore. And so if we can take the affordability out of their hands and put them into our centers where we know they're getting a medicine, I think that's where we're headed. And not only do we have intracameral devices now, we have intracanalicular punctal devices, and the market's really changing.
Yeah, well, tell us a little bit more about those two particular devices you just mentioned, the intracanalicular and intracameral anti-inflammatories. What do we have there?
So outside of the prior Trimoxy, which Imprimis promoted, which was a fantastic product, and other people are compounding their own, we now that goes in from a liquid to a solid. It's treatment for postoperative inflammation. And then on top of Dexacu, we have Dextenza, and Dextenza now is a punctal plug that does not have to use postoperative, steroid drops or nonsteroidals.
Right, and you mentioned earlier issues with compliance and accessibility to medications. It seems like this would be a really good way in order to provide the anti-inflammatory that's needed after cataract surgery without having to rely on the patient to provide it his or herself, or to pick it up from the pharmacy and pay expensive copays and so forth.
Well, yeah, I mean, if you think about it, in any other facility setting, when you're in a hospital, we don't rely on the patient to push their own drug. At the time of surgery, have an ability to put something in that will stay, that will eliminate their need for their family to go pick up the drugs, for the pharmacy to deny it, for the insurance company to say you don't qualify for this. Imagine eliminating all that, and they have no phone calls for drops. It would really be a game changer.
That really is an important aspect that also needs to be considered. A lot of our presenters have, and I personally have advocated for dropless cataract surgery, and we're moving closer there. It seems like these products allow us to potentially reduce or eliminate the need for topical steroid eye drops, and if used in an off-label manner, people can use intracameral antibiotics. What about the NSAID? Do we still need to use the NSAID? Meaning, are we at that dropless point yet, or are we just almost there?
Well, it depends on who you talk to. Everybody has a different opinion. Some people think, but haven't been using NSAIDs for years. So I think the literature is muddied. It depends on what study you're looking at. There's certainly studies that show that an NSAID will definitely reduce your postoperative CME, and there's certainly studies that say it didn't make a difference. And so I'm not sure where we're at yet, and I'm not sure.
Right on. I wonder also, in a final thought regarding the two technologies which you just spoke of, one an intracanalicular steroid depot and one an intracameral steroid depot. Are those two products meant to be used exclusive of each other, or could you imagine scenarios where perhaps even in an off-label fashion you may consider combining them?
Right now they're considered to be, I think, completely separate of one another. However, I think depending on how you're treating topical drop, and so I think it would be reasonable to consider having both in the eye or in the periocular area.
Well, this has been a great